Hi, I'm Marcel Tetzloff. I'm a Regional Vice President of Provider Networks at DentaQuest. Today I want to talk to you about all the changes going on as a result of the Affordable Care Act. It affects everybody, insurance companies, doctors, dentists, and patients. My goal is to help the more than 37,000 dentists participating in DentaQuest networks and programs understand how the Affordable Care Act, or the ACA, affects them. This is the first of a series of presentations that will give you the information you need to participate in our networks and programs. We've been communicating with you all year long via conference calls, emails, and other methods. This series of 1 to 2 minute videos will answer your most frequently asked questions about the ACA. They will be posted on our website so you can watch them as time allows. Today, I'd like to give you a broad overview of the ACA. It is an act that requires most U.S. citizens to obtain health insurance. If you are a U.S. citizen and do not qualify for government-sponsored insurance through programs like Medicaid, Medicare, or CHIP, or you do not have access to insurance coverage through your employer, you will be required to obtain coverage through newly established insurance marketplaces. We'll discuss marketplaces in a separate video segment. Those without insurance coverage will be required to pay financial penalties, although exceptions will be granted for financial hardship and other concerns. The ACA lists 10 categories of health benefits that must be covered by insurance, known as Essential Health Benefits, or EHP, and they include dental benefits for children up to age 19. I'll be talking more about this later too. These are some of the major components of the ACA, and in future presentations I'll go into greater detail about these and other issues that may affect you. Thank you for all you do every day to give our members the dental care they need. I hope this series of videos will help you more fully participate in our programs. The videos are available on our website, DentaQuest.com. If you have questions about the ACA after watching these videos, please call us toll-free at 855-873-1283 or email us at 4marketplace@DentaQuest.com or contact your provider relations representative. One of the most important aspects of the Affordable Care Act is that it helps create a new way for Americans to obtain dental and other health benefits through health insurance marketplaces. Not everyone can get their insurance on marketplaces. They are only open to certain populations. By 2014, the ACA requires states to establish 2 public marketplaces to provide dental and other health benefits. One marketplace is for individuals and families, and one is for small businesses up to 100 employees. Marketplaces simplify the search for health coverage by providing a list of options in one place. Consumers can compare plans based on price, benefits, quality, and other features. Prices and benefits will be written in simple language. Consumers will get a clear picture of what premiums they'll pay and what benefits they'll get. They can choose a price and coverage that fits their budget. Dental benefits will be available to consumers in a competitive marketplace setting. Health plans will offer dental benefits on marketplaces in one of 3 ways. 1. As an embedded product. This means dental benefits are integrated as part of a health plan's medical product. 2. As a bundled benefit. The dental benefit is part of a dual offering by the health plan, independent of the medical product. And 3. As a standalone product. Dental benefits are offered separately from a health plan's medical product by a qualified dental plan. Qualified dental plans like DentaQuest will also be offering dental benefits on their own and not necessarily partnering with health plans. Enrollment for those eligible for participation on marketplaces begins in October, and the programs and benefits will begin on January 1st, 2014. In future presentations, we'll be discussing other aspects of the ACA, such as eligibility requirements and essential health benefits. Many of us have heard about the Essential Health Benefits portion of the Affordable Care Act, but you may have questions about exactly what those essential health benefits are and why they might matter to oral health providers. The ACA contains a number of provisions to ensure that Americans have access to quality, affordable health insurance. One of these provisions is a list of essential health benefits in 10 broad healthcare categories. Those categories are ambulatory patient services, emergency services, hospitalization, maternity and newborn care, mental health and substance abuse disorder services including behavioral health treatment, prescription drugs, rehabilitative services and devices, laboratory services, preventive and wellness services and chronic disease management, and pediatric services including oral health care for children up to age 19. The Essential Health Benefits Package provides a comprehensive set of services, covers at least 60% of the actuarial value of the covered benefits, but is not more extensive than the typical employer plan. Every health plan must offer these benefits to individuals and small groups both on and off the marketplaces. Health plans may impose cost-sharing obligations on plan members for most essential health benefits, but those that qualify under a category of preventive health services will be made available at no charge to plan members. In most states, the pediatric dental benefit will be based on those offered by the state's CHIP program, or they might be based on the pediatric dental benefits offered by the Federal Employees Dental and Vision Insurance Program, also known as FEDVIP. One of the most common questions about the Affordable Care Act is who will be eligible for health care coverage under this law. The Affordable Care Act fills in current gaps in coverage for Americans by creating a minimum Medicaid income eligibility level across the country. Beginning in January 2014, individuals under 65 years of age with income below 133% of the federal poverty level, or FPL, will be eligible for Medicaid. For the first time, low-income adults without children will be guaranteed coverage through Medicaid in every state without the need for a waiver, and parents of children will be eligible at a uniform income level across all states. Medicaid and CHIP eligibility and enrollment will be much simpler and will be coordinated with the insurance marketplaces. Those who qualify for a government program like Medicaid, Medicare, or CHIP do not have to purchase coverage on an insurance marketplace. If your state chooses to implement the ACA Medicaid expansion, then more individuals would become eligible for the Medicaid program. If your state chooses to expand their Medicaid program, that means they would be raising the federal poverty level in your state, making more individuals eligible for Medicaid. However, if they do not qualify for Medicaid, do not have coverage through their current employer, and their income is from 100% to 400% of the federal poverty level, then they would be eligible for a government tax credit. Also referred to as subsidies, these tax credits help pay for the cost of insurance coverage purchased through insurance marketplaces. Credits are determined on a sliding scale. The current programs you accept through Medicaid, Medicare, or programs you participate in with DentaQuest are not affected by the provisions of the Affordable Care Act. Benefit structures, fees, and covered services will not change. Many dental providers are concerned about how the Affordable Care Act might affect them. In this video, I'll discuss the possible effects of the ACA on the dental community. The ACA attempts to address some of the most pressing issues concerning oral health care, including pediatric care, professional training, and education. The Affordable Care Act requires insurers to offer dental care for children. As a result of this pediatric mandate, dentists may see an increase in the number of children seeking dental care. There are provisions in the ACA that allow grants and loan repayment programs for healthcare professionals, including dental students. The law provides funding to expand access to dentists in areas known as dental deserts. A dental desert is a community where residents have no access to oral health care providers. Also, in an effort to address dental deserts, the ACA provides funding to establish training programs for alternative dental providers, hygienists for example, to help people access dental care in areas where there might be few or no dentists. In addition, the ACA provides funding to national public education programs on oral disease prevention, as well as a program to enhance education for community-based dental care providers. Dentists know how effective preventive care and oral health education can be, and the ACA takes steps toward improving these on-the-ground efforts. The points I've outlined here are some of the most talked about portions of the ACA regarding dental care. As each state prepares for healthcare marketplaces, DentaQuest sometimes receives questions from dentists wondering what they need to do to enroll in a marketplace network. In the first quarter of 2013, depending on the requirements of the state, DentaQuest has already done one of the following: amended your provider agreement, obtained an attestation from you, or obtained a new provider agreement. These actions will allow you to participate in our network, to treat members who will either receive dental benefits directly from us or who will have benefit plans that are administered by us. If you haven't already received the necessary paperwork to participate in our network, I urge you to contact us toll-free at 855-873-1283 so we can provide that to you as soon as possible. Healthcare reform is complex and can be confusing at times. But at DentaQuest, we're glad to help you navigate these changes. So far, we've covered the basics of the Affordable Care Act, including a discussion of essential health benefits, what they are, and what they might mean to the dental providers. Now I'd like to expand on an essential health benefit of particular interest to dentists, the pediatric dental mandate. As an essential health benefit, dental benefits for children must be offered within state healthcare marketplaces and to most small employers outside the marketplaces. Any medical coverage offered on a marketplace must include a pediatric dental benefit. The only exception to this is if the same marketplace offers a standalone dental plan providing pediatric dental care. In that case, the medical plan isn't required to provide pediatric dental. Dentists may be impacted by the fact that traditional pediatric orthodontic coverage may not be available via state healthcare marketplaces unless those orthodontic treatments are considered medically necessary. Some pediatric orthodontia may be available, but those benefits will likely vary from plan to plan. When parents or guardians purchase pediatric dental coverage for dependents, they may then need to purchase those benefits separately for themselves to maintain good oral health. This means adults purchasing dental through a healthcare marketplace could have different benefits than their children. As more families access medical and dental benefits via healthcare marketplaces, more questions will likely arise. At DentaQuest, we're constantly monitoring developments in healthcare reform so we can provide the most up-to-date information to you. One important question dentists are asking now is how the Affordable Care Act might affect their offices. We've talked about possible effects the ACA might have on individual providers. Now let's take a look at how the ACA, and specifically how healthcare marketplaces, could bring about changes at your dental office. DentaQuest will be a standalone dental option in several states. This means individuals in those places who want to buy dental benefits on their state's healthcare marketplace will see DentaQuest as an option. They will be able to purchase dental plans directly from DentaQuest and can access care at your office under those plans. In addition, DentaQuest will be a back office administrator to health plans and marketplaces in many other states. This means we will provide administrative services for the dental component of one or more health plans in those states. For example, when an individual or family purchases health coverage from a health plan on that marketplace, and that plan includes dental care, DentaQuest will provide the back office dental services for those plans, and your office will be working with DentaQuest in that administrative capacity. This is very similar to many of the administrative relationships we have today and that you are used to working within. If you provide dental care to Medicaid, Medicare, or CHIP recipients, those programs will stay the same. Your office shouldn't see any difference in working with those patients. As the effects of healthcare reform unfold, DentaQuest will continue to support our providers and keep you up to date on the ACA developments. Supporting your practice is a top priority for us. In keeping with that level of support, there are several online resources you should be aware of. I hope you'll find them useful.